Ocular Vitamins 7160 Unit, 113 mg, 0.5 mg tablet multivitamins is a multivitamin product that is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. Vitamins are important building blocks of the body and help keep you in good health. It is important to take this medication as directed by your doctor. The recommended daily dosage may vary depending on your specific needs. It is best to take this medication with a meal to help with absorption. Always consult with your healthcare provider before starting any new medication. When taking Ocular Vitamins 7160 Unit, 113 mg, 0.5 mg tablet multivitamins, it is recommended to take it by mouth, usually once daily or as directed by your doctor. It is important to follow all directions on the product package and not to exceed the recommended dosage. Taking this medication regularly will help you get the most benefit from it, so try to take it at the same time each day to help you remember. If you have any questions about the dosage or timing, be sure to consult your doctor or pharmacist. Some possible side effects of Ocular Vitamins 7160 Unit, 113 mg, 0.5 mg tablet multivitamins are constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication, it means that they have determined the benefit to you outweighs the risk of side effects. Many people who use this medication do not experience serious side effects. While it is rare, a very serious allergic reaction to this drug is possible. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. The optimal timing for taking Ocular Vitamins 7160 Unit, 113 mg, 0.5 mg tablet multivitamins, as well as the daily dosage, should be determined by your healthcare provider based on your individual needs and condition. It's important to keep multivitamins with iron out of reach of children, as accidental overdose can be fatal. If overdose occurs, seek medical help or call a poison control center immediately. Before taking Ocular Vitamins 7160 Unit, 113 mg, 0.5 mg tablet multivitamins, make sure to inform your doctor if you have any allergies to its ingredients, soy, peanuts, or any other allergies. It's important to discuss your medical history, especially if you have a history of alcohol abuse, liver problems, or stomach/intestinal issues. If the multivitamin also contains folic acid, let your doctor know if you have a vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency. It's crucial to inform your doctor about all the medications, including herbal products, you are using before undergoing surgery. If you are pregnant or breastfeeding, consult your doctor before using this medication. Drug interactions can affect how your medications work and increase your risk of side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medication without consulting your doctor. If your multivitamin contains iron, be cautious about taking it with antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Ask your healthcare provider for guidance on how to schedule your doses. If your multivitamin contains folic acid, let your doctor or pharmacist know if you take certain anti-seizure drugs. This medication may also interfere with certain lab tests, so be sure to inform the lab personnel and all your doctors that you are taking this medication. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or your local poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Make sure to keep all of your medical and lab appointments. It's possible that some brands of ocular vitamins may also include ingredients like docusate. If you have any questions about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. Remember, these vitamins are not a replacement for a balanced diet. It's best to get your vitamins from healthy foods, so make sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. If you are taking this medication on a prescribed schedule and happen to miss a dose, take it as soon as you remember. However, if it's close to the time of your next dose, it's best to just skip the missed dose and take your next dose at the regular time. It's important not to double the dose to make up for the missed one. It's important to store Ocular Vitamins 7160 Unit-113 Mg-0.5 mg tablet multivitamins at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposal, do not flush the medication down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.